Sudden death in young people is one of the most frightening and misunderstood health realities of modern times because it often strikes without warning and affects individuals who appear healthy, active, and full of life. Families are left devastated, doctors are questioned, and society struggles to understand how someone so young could die suddenly. While official explanations often mention heart attack or natural causes, there are many deeper contributing factors that are rarely discussed openly. These causes are complex, interconnected, and often ignored until it is too late. Understanding them is not about creating fear, but about awareness, prevention, and saving lives. Many young people today live under intense physical, mental, and emotional stress. Academic pressure, financial insecurity, career competition, social media comparison, and lack of proper rest have silently changed how young bodies function. Chronic stress leads to constant release of stress hormones like cortisol and adrenaline, which over time strain the heart, disturb blood pressure, increase inflammation, and disrupt normal heart rhythms. This creates a hidden risk where the heart may suddenly fail under pressure even without prior symptoms. One of the most overlooked causes of sudden death in young people is undiagnosed heart conditions. Many congenital heart abnormalities do not produce obvious symptoms. Conditions like hypertrophic cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, long QT syndrome, and other electrical disorders of the heart can remain silent for years. A young person may feel occasional palpitations, dizziness, or brief fainting episodes, which are often ignored or blamed on anxiety, dehydration, or lack of sleep. During intense physical activity, emotional stress, or sudden exertion, the heart's electrical system can malfunction, leading to sudden cardiac arrest within seconds. Another major contributor is electrolyte imbalance, which is rarely taken seriously. Potassium, magnesium, sodium, and calcium play a critical role in maintaining normal heart rhythm. Poor diet, excessive caffeine, energy drinks, crash dieting, vomiting, diarrhea, or heavy sweating during workouts can disrupt these levels. Even mild imbalance can trigger dangerous arrhythmias, especially in individuals with underlying vulnerabilities. Many young people consume energy drinks, supplements, and pre-workout formulas that overstimulate the nervous system and increase heart rate and blood pressure dramatically. These products are often marketed as safe, but in reality they can push the heart beyond its limits, especially when combined with dehydration, lack of sleep, or stress. Sleep deprivation itself is a silent killer. Consistently sleeping less than 6 hours affects heart rhythm, blood pressure, glucose regulation, and immune function. Lack of sleep increases the risk of fatal arrhythmias because the heart never gets enough recovery time. Many sudden deaths occur early in the morning when the body transitions from sleep to wakefulness, a time when stress hormones surge and the heart is particularly vulnerable. Another shocking but real factor is undiagnosed infections and inflammation. Viral infections like myocarditis can inflame the heart muscle without severe symptoms. A young person may experience mild flu-like illness, chest discomfort, or fatigue and continue daily activities, including sports. Inflammation weakens the heart muscle and disrupts electrical signals. Ever heard those shocking stories about a young, seemingly healthy person suddenly passing away? It's heartbreaking and frankly, terrifying. What causes this? And more importantly, can we do anything about it? Today, we're diving deep into the topic of sudden death in young people. Let's get one thing straight. This is incredibly rare. But when it does happen, it often leaves everyone wondering why. The most common culprit is something called sudden cardiac arrest, or SCA. This isn't the same as a heart attack, which is a plumbing problem in the heart's arteries. SCA is an electrical problem. The heart's rhythm goes haywire. It stops pumping blood effectively. And without immediate intervention, it can be fatal within minutes. So, what triggers this electrical chaos in a young person's heart? Often it's an underlying heart condition they never knew they had. Things like hypertrophic cardiomyopathy, or HCM, where the heart muscle becomes abnormally thick. This can mess with the heart's electrical signals, especially during intense physical activity. Another one is arrhythmogenic cardiomyopathy, where healthy heart muscle is replaced by fatty or fibrous tissue, making the heart's walls thin and weak. There are also conditions called channelopathies, like long QT syndrome. Think of these as problems with the tiny ion channels that control the heart's electrical flow. A trigger like extreme stress, a loud noise, or even sleep can set off a dangerously fast and chaotic heartbeat. And it's not always the heart. Sometimes, a ruptured brain aneurysm or a severe asthma attack can lead to sudden death. But heart-related issues are the most frequent cause in these tragic cases. So, what are the warning signs? This is crucial. Many times there are no obvious symptoms before the event. But sometimes, there are subtle clues. Unexplained fainting, especially during or after exercise, is a major red flag. So are chest pains, a fluttering or racing heartbeat, unusual shortness of breath, and extreme, unexplained fatigue. A family history of sudden unexplained death before the age of 50 is also a significant warning sign. If you or a young person you know experiences any of these symptoms, please, don't ignore them. Don't just brush it off as being out of shape or having anxiety. See a doctor. Get it checked out. An electrocardiogram or ECG and an echocardiogram are simple, painless tests that can detect many of these underlying conditions. For schools and sports teams, Having an emergency action plan is vital. This includes knowing the signs of cardiac arrest, calling emergency services immediately, and having access to an automated external defibrillator, or AED. These devices are lifesavers. They can analyze the heart's rhythm and deliver an electrical shock to restore a normal heartbeat. Anyone can use an AED. They literally talk you through the steps. Early CPR and a shock from an AED can double or even triple a person's chance of survival. Knowledge is power. Understanding the causes and recognizing the warning signs can make all the difference. Regular checkups, especially for young athletes or those with a concerning family history, are so important. Let's encourage open conversations about heart health no matter how young we are. This topic can be distressing, and if you've been affected by the loss of a young person or are feeling anxious about your own health, please talk to someone. Reach out to a healthcare provider, a counselor, or a support group. You're not alone. Thanks for watching. Please share this video. It might just help save a life. Take care of yourselves and each other. See you in the next one.